good day everyone. I am Marilyn Tandaan, a student nurse from BSN1F. So today I will be performing donning and removing gloves for the purposes to enable the nurse to handle or touch sterile object freely without contaminating them, and to prevent transmission of potentially ineffective organism from the nurse hands to the client at high risk for infections. For the assessment review the client record in order to determine exactly what procedure will be performed that requires sterile gloves. Check the client's record and ask about latex allergies. Use non-latex glove whenever possible. So I will be checking the client's record. So, good morning, ma'am. I am Marilyn Tandaan, is your student nurse for today. So, may I know your name po, ma'am?
Francesca Luis H. Zarella.
So, how about po your date of birth?
July 25, 2010.
So, how was it po, ma'am? So, according to your record po, ma'am, I will be performing a procedures that require sterile gloves. So, for us to prevent transmissions of high risk of infections, so and freely without contaminating of organisms. So, do you have any allergies po, ma'am, from latex?
No.
So, none po. Okay, thank you po. So, I will just be closing this door po for your privacy. So, I'm done interviewing the client, so I can now proceed to the procedure, which is donning and removing gloves. So, since my client is really don't have allergy of latex, I will be using a sterile gloves. So, here, I prepared a package of sterile gloves for the equipment needed and trash bin. So I already placed the gloves on the clean and dry surface to ensure that the gloves are in the right size and the packaging has no tears or stain. So it is important to ensure that the gloves fit well and it is not expired. So okay, now I am going to remove the outer wrapper, the package. To do this carefully by peeling off the sides, and be careful not to spill the inside content to keep the sterility of the gloves. So now open the inner package, or inner wrapper, while holding it or according to the manufacturer instruction. Make sure do not touch the inner surfaces to stay the sterility of the gloves. Identify the left and right gloves, and for the easier application, put the first glove on the dominant hand. So since I'm right-handed, I am going to don gloves in my right hand first. So to do this, I'll I'll have to cross the cuff of the glove in the folded edge with the thumb and first finger of the non-dominant hand. So it's going to be like this. So touch only the inside of the cuff. Insert the non-dominant hand into the gloves and pull the gloves on. So keep the thumb of the inserted hand against the palm of the hand during insertion. So now I am going to donning my glove hand in my dominant hand. So now I am going to glove my non-dominant hand. To do that, I'll have to slip my fingers beneath the cuff of the other glove to slip it into my non-dominant hand. So it must be the 4. So now, since my both hands are now gloves, I can arrange the gloves so then after doing that, we must clasp our hand in front of our body. So okay, hold it like this, away from the body. This is done to avoid accidental touching of non-sterile object and in front of our uniform. So like this. So I am done doing the procedure to the client. So okay, now to remove the gloves, all we have to do is to first remove the gloves of the non-dominant hand by pitching the glove at the palm of our hand. So, and remove it. So, okay, for the non-dominant hand, we are going to slip the fingers under the gloves or like this, and how we can discard it or remove it. So, like this. So we can now discard it to the trash bin. They use gloves. So here